So, having a little discussion about the Atenolol shortage that we have in the world of pharmacy.
Yeah.
Atenolol is a very common medication used for blood pressure. It can help control heart rate, and for the last at least the last month or so, we've had a nationwide shortage of the medication, and it's really caused a lot of problems with changing people's medications around, and there's a lot of inherent risks with that.
And so, like, yeah, can you kind of describe that, like, their risks?
Oh, anytime that you have to make medication changes, or there's any sort of switches in therapy whatsoever, there's a kind of a learning curve where the patient, there's a stage of ambiguity where it's not exactly clear what the what's intended to be done. Sometimes that can be the patient doesn't listen at the doctor's office, or the doctor doesn't explain it well, and then same thing all the way down to the pharmacy. And if anytime there's changes, it just poses a large risk.
Yeah, yeah. And so, like, what are you seeing, pharmacies doing now? What are you all doing at Mercy? Or...
So currently we still have some in stock. We have maybe a few thousand pills. Uh, it's not expected to be back and available until towards the end of September, and that's just more of a guess than anything. So right now we are still sitting okay. I know that there's pharmacies in Dubuque that do not have any in stock and have had to, call the doctor's office and switch medications to something in the same class. For example, metoprolol is a medication in the same class that would have similar effects. It would continue to help treat blood pressure and heart rate, but again, there's risks with any changes.